Hi, Gail and classmate. We are family group 2. We are presenting our family case scenario. The member of the group are myself, Angelita, Melanie, and Melissa. Presentation, we will discuss a case scenario of family who is in crisis. We involve the community health nurse, social worker, and nurse educator. Our objective include postvention and strategies, identifying the precipitating factors for crisis or problem, and explain how this impact to you and to the family to your care. Decision making, to learn about the needs of families dealing with family crisis and appropriate decision related to the management of such risks. Holding skill, use suitable and acceptable intervention to reduce and manage the risk of the situation or crisis. Postvention approach, identifying the impact of the crisis event and describe postvention approach response that can be used for priority of care, support, and follow-up action. Genogram uses a standardized set of connection to graphically record basic information about family members and their relationship over the three generations. This is the genogram of the family. Mr. Torino, who married to Mrs. Torino, but Mr. Torino was passed away 8 years ago. Mrs. Torino is 72 years old. If you see on the diagram, there's a triangle on both corner. The below corner, which it means Mrs. Torino was having diabetes and uncontrolled hypertension, while the above corner, she recently diagnosed with dementia. So this couple, they have their children named Natalie, who is 38 years old, her brother named Stefano, who is 33 years old, and her sister named Jana, who is 35 years old, which is they're living 10 kilometers away to the family. So when Natalie got married, her husband named Mario, who is 42 years old, uh, on the above corner, he also has a triangle, which means he has a diagnosed hyperlipidemia since 2017, but he's taking his own medication, which is preventable. So on the big triangle, Natalie, she's uh, uh, she's a pregnant with her third child. So this couple also have their children named Andrea, who is 5 years old, and Alessandro, who is 3 years old. They are both in daycare.
Mrs. Torino originated in Venice, Italy, and is Roman Catholic. She's a full time mother to her three children. She raised them with her husband, who worked full time before he passed away 8 years ago. They immigrated in Canada in 1980, where three children were born and raised. They are a middle class family. Currently, they live in Oakville, Ontario, in a two-story home with three bedrooms. Their community and environment is generally safe and healthy. Mrs. Torino is a widow who currently resides with her daughter and her family. She has recently been having issues surrounding her mobility and gait. She is experiencing frequent falls and now has been diagnosed with dementia. She often forgets or hides her medication for her blood pressure and type 2 diabetes. There has been a recent concern for her safety at home alone, such as leaving the stove on and leaving the house. Her daughter and her husband work full time outside home. They have two small children under the age of 5, and both of them are attending daycare. Now, Mrs. Torino's daughter has announced that she is pregnant with her third child. Her daughter Natalie would like Mrs. Torino to move into a nursing home for her safety, but she is refusing. Natalie is experiencing caregiver burnout. She has two other siblings, who are refusing to help her out with her mother and tell Natalie to just put her in a nursing home. Being of Italian descent, it is customary for the mother to live with one of the daughters when they get older and not in a nursing home. She is experiencing guilt about sending her mom. She is concerned that her mom will not be able to communicate with others because of her limited English. They have lived in an Italian community ever since they came to Canada.
Impact of family social characteristics, family lifestyle patterns. The changes in roles and responsibilities of each family member to take care of the ill family member. Natalie barely had enough time for herself. She is juggling between her job, her responsibilities at home, and taking care of her mother. Family culture. Miss Torino has a strong Italian culture where the elders are being cared for at home. She is expecting to live with her daughter until her last breath. Degree of acculturation. Living in Canada since 1980. Her 3 children were all born in Canada, whom have already acquired the Canadian culture and system.
The ECOMAP. ECOMAP means provide information about systems outside of the immediate nuclear family that are sources of social support or that are stressor to the family. So this is the ECOMAP of the family. So there are 4 arrows on the illustration. So the zigzag means stressful connection. The thick line means strong connection. The thin line means tenuous connection. And the broken line means distance connection. So this is one of the tools that we using for the intervention for the family to make help them or give them an immediate solution for the crisis that facing for the family. Hi Natalie, my name is Angelita. I am one of the nurses here in your community. I am here to help you to find the solutions to the crisis that you are facing right now. Hello Angelita, my whole family was affected because of my mom condition and I don't know how to plan and organize so we can get back to a normal life. We can discuss a plan and I can refer you to the other healthcare professional that I know so you can meet your goal or needs of your family. Community health nurses have had their attention focused on high-risk people, the young, the elderly, and the pregnant. All people, regardless of the age, are more high risk if they are poor and without access to the medical care. In this scenario, the whole family was affected, and as a nurse, my role is to gather all the data and share this to the team so we can build a plan that meets the needs of the family.
Hi Natalie, I am Melissa and I am a nurse educator. So I am here today to give you some information about dementia.
Nice to meet you, Melissa, and it's my pleasure to learn about dementia, which my mom was suffering her cognitive disability.
So dementia is a set of symptoms that is the result of disorders affecting the brain. The disease is progressive and neurodegenerative. That is, it worsens over time as brain cells incur damage and die. So the symptoms may include memory loss, impairment in reasoning and problem solving, and changes in mood and behavior that rob a person of his or her independence. So while Alzheimer's is the most common form of irreversible dementia, other forms like vascular dementia caused by stroke is common too. So, when a family member is diagnosed with a chronic illness, the quality of life for the family, regardless of culture or religion, is substantially altered. The family's functioning, resiliency, and the ability to manage daily life activities are drastically impacted, as all members experiences the emotional impact and physical burden of individuals' care. Many patients with chronic health conditions find that involving family and friends in their care provides a crucial source of day to day support. And to fully address the needs of older adults with chronic health conditions and their network of supporters, Programs may need to extend beyond the patient's own households.
Hi Natalie, my name is Melanie Lucido and I'm the social worker. The reason why I'm here today is to provide you and your family with some resources for Mrs. Torino. I understand that your family is struggling to find the best outcome for your mom with dementia, and I hope you find some of the resources I provide you today useful.
Thank you, Melanie, for visiting us. I really don't know what I'm going to do to my mom. She doesn't want to send her to the nursing home, and I'm worried for my husband and my 2 kids, that which I need to give time also. How can you help me?
The Alzheimer's Association provides a service for people like your mom, such as the Adult Daycare Center. While your mom's at the center, you will have an opportunity to go to work without the worry or feeling of guilt. The Adult Daycare Center can be very helpful as you try to balance your job and caregiving duties. The hours of service may vary at each center, and some are open up to 7 to 10 hours a day. Some also offer weekend hours and evening. Transportation and meals are provided at the center. For people like your mom who has dementia, Mrs. Torino would have the opportunity to participate in staff programs such as exercise and music programs. Some adult daycare centers provide counseling for the family, nutrition, behavioral therapy, personal care, and nutrition. Other respite services are offered through CCAC, such as family night programs, short-term stay, overnight stay, group activities, and friendly visiting. I will also provide you a list of websites that you may find beneficial after this interview. Psychosocial considerations. All the emotional needs and feelings of each family member involved in this case scenario. It is important as the nurse that these needs are met, as there is a feeling of loss involved by all. As a social worker, one can offer assistance to support their emotional needs through different support groups, by actively listening to each family member and realizing that sometimes one can offer support. As each family member expresses their concerns, it is imperative that the healthcare provider does not interrupt, provide excess sympathy, actively listen, and to provide resources to the family. Five commendations for this family. Number 1, your family has shown great strength in caring for your mom during this difficult time. Number 2, Ms. Torino, you've done incredibly well over all these years looking after Natalie and her family. Number 3, Ms. Torino, you've suffered the loss of your husband and been a source of great support for Natalie and her family. Number 4, I'm impressed how well this family has come together to look after your mom and meeting the needs of everyone during this difficult time. The last commendation one can offer is, it is heartwarming to see how this family is committed to finding a solution that meets the needs of everyone.
Some of the tools that we use to assess the family and come up with a family care plan includes: first is the family assessment and intervention model. This model focuses not just on individual, but the whole family as a client. It will focus on what causes stress to the family, how they will react to it, and what strategies they can use to build their strength as a family. Second is the Family Reasoning Web. This tool will help analyze Torino family's story by clustering individual pieces of data into a meaningful family categories that would make implementation of care plan easier. Our priorities for the family includes immediate solution for the new crisis of the family, coping skills strategies for Mario and Natalie, safety for Mrs. Torino, and resources or support system for the family. Interventions and implementation. First, encouraging caregivers to learn more about the disease, to evaluate the needs of family caregivers, develop a support plan, and make appropriate referrals, understand what is available in the community for social support, the use of available community resources such as respite, home health care, adult daycare, geriatric care, housekeeping services, home health aides, meals on wheels, companion services, and others as appropriate. Next is encourage them and their family members to join caregiver support groups. And there are many resources on caregiving, including support groups at local agencies, a wide range of self help books in bookstores, and numerous virtual communities. Other intervention includes education and counseling to help identify available resources and make appropriate decision regarding care recipient, legal and financial issue to help alleviate the economic burden of family caregiving, follow up, which is an essential component of best practices in crisis intervention. It involves assessing whether clients' coping strategies are effective, enhancing supports as needed, and evaluating the outcomes of crisis resolution. This follow up is best planned and arranged by the professionals who help the client work through the crisis event.
Conclusion. All family go through crisis at one point or another. In this scenario, this typical family has a lot of challenge, but with the right interventions from the healthcare team, they will get through this crisis much better. It is the right thing for Natalie to speak to the nurse about her problem. A lot of people do not like speaking about their crisis or anything about their personal well-being. In this scenario, the healthcare team develop a plan, goals with the client-centered initiatives, bringing into the team to the healthcare professional required to be successful. At the end, the family was able to be happy and continue with a more structured and agreed plan for continued happiness. Thank you for watching our presentation. If you have any question or comment, please don't be hesitate to put on our group discussion board. Thank you and have a great day.